Hi, doctor. How are you?
Hi, how you doing?
Great. Dr. Rahimian, introduce yourself and tell us what do you do?
My name is Vahid Rahimian and I'm a doctor of chiropractic. And chiropractic is basically about giving a body a chance to naturally heal itself. And in here we do everything from spinal manipulation to laser to traction of the spine and also acupuncture.
And why did you choose this field and profession?
I was always fascinated with how the body works, and I always had this question in mind that how can we help the body to heal itself naturally. And when I look at the different professions in the field of healthcare, I found out that chiropractic is the only natural way that helps the body in every aspect, and that's why I chose this field.
Why do some people have their perception that chiropractors are not real doctors?
Yeah, the problem comes that, especially in the US, everything goes around pharmacology and pharmaceutical companies. And unfortunately, in the US, we have the problem of which benefits those companies better. And when you think about it, as a natural doctor and trying to help patients heal naturally, of course it's not beneficial for the pharmaceuticals to have this type of doctors around. And that's why they try to bring down chiropractors, and they always say, yeah, chiropractors are not real doctors, don't go to them. But when you look at the research, there's a ton of research done on the effectiveness of chiropractic for patients, and not just for headaches, neck pain, and low back pain. And the new research every day shows that chiropractic is helping with all sorts of diseases, from allergy to fibromyalgia and even cancer.
Before you become a chiropractor, did you expect whatever you're doing now, did you think that this is gonna be it, or you expected something else?
Absolutely. I actually had less expectations when I wanted to become a chiropractor. I thought that, chiropractic in that time is only good for neck pain, headaches, accidents, falls, slips. But, after, practicing more and more and seeing more patients and what we can do naturally, especially, like there are a variety of problems, that people have. Anything, as I said, from high blood pressure to high cholesterol, and just a very, very small, simple advice changes their lives. Because, for example, in the past, I had patients that didn't know they should drink, for example, 6 glasses of water a day. And the only thing they were drinking was sodas. And when I, just told them as simple as, hey, drink more water, and they started doing that, a lot of their problems disappeared. So as easy as that, we can help different types of patients, and, just try to get them better.
Sometimes females or kids, they have their very small personal space. And how do they feel when you get so close to their personal space, even though they know that you're a doctor, that's what you do? And there's so many problems around here now that, people and doctors being too in personal space. What do you feel, and how do you think people feel about you getting to the personal space and move them around, if they're kids, if they're female, if they're adults?
Sure. Yeah, actually, since you mentioned that, there's actually a lot of patients that love to be touched. A lot of patients, when they go to a medical doctor, for example, and the doctor just talks to them without going through their social history, without asking them what type of problems they have in life. And chiropractors, they always say it's a touchy profession. And again, for that type of patients, they're okay with us, we do everything. And for the other types of patients, that don't want to be touched, and all that, we try to explain to them as much as we can. For example, we tell them, hey, we do this to bring this bone back in place, or, we have to, for example, palpate your neck or palpate your low back to find problems in that area. And usually when you explain it to the patient, they're okay with it. The problem in the society comes from not knowing. And unfortunately, I totally agree with you. There's a lot of doctors that do this type of problems without they do
advantage of
yes, they do all sorts of adjustments, for example, manipulations, without telling the patients what they're doing. And I think all of these problems are going to be resolved when you tell the patient, this is what I'm going to do, this is what I'm going to touch, and you just fix that area and go to the other.
So it's basically the lack of knowledge that patients and people have
exactly
about your field, right?
Exactly. Lack of knowledge, and some of the problem comes from the chiropractors themselves, for not explaining what they want to do. And I think like when you explain it to the patient, they're totally comfortable with it.